Good morning. Bonjour à tous. My name is Ayla Amir, and in my role as the Executive Director of AMI-Quebec, I'm very pleased to welcome you to the second Quebec Symposium on Young Carers. First, I wish to recognize that we are gathering today on unceded Indigenous territory, on lands with a rich history of occupation and stewardship by Indigenous peoples for millennia through to the present day. En reconnaissant l'endroit où nous nous réunissons aujourd'hui, j'espère que nous nous souviendrons tous de notre relation avec la Terre et entre les personnes, les communautés et les systèmes. Cette relation et les soins qu'elle nécessite est au cœur de ce dont nous sommes ici pour discuter. All of the interventions to be discussed today need to be prefaced with the acknowledgement and knowledge of the impacts of the ongoing and historical nation-to-nation relations here and wherever you are joining us from. I cannot move on without acknowledging my deepest pain about the many wars, armed conflicts, and mass violence in the world right now. I wish we can recognize that hatred, revenge, and retaliation can offer at best a momentary relief from pain, but respect, kindness, and love can sustain our humanity. Ce colloque, comme le premier en 2019, a été piloté par AMI-Québec avec la participation d'un groupe de travail qui partage nos objectifs et nos aspirations. When we presented the first Young Carers Symposium back in 2019, very little attention was paid to the children and youth in Quebec who provide unpaid care to family members with chronic illness, disability, mental health or substance use issue, and/or problems related to old age. While caregiving can have many benefits, there are important risks and negative outcomes, especially when associated with young age. À l'époque, notre objectif était d'accroître la sensibilisation et la reconnaissance des gens aidants et de leur droit à l'information, à l'orientation et au soutien. Aujourd'hui, l'élan autour des questions relatives aux gens aidants se renforce au Canada et nous pensons qu'il est temps de passer de la sensibilisation et de la mise à évidence des gens aidants à l'action et à l'établissement de notre parcours collectif. Nous croyons que le Québec peut devenir une chef de file dans la reconnaissance et le soutien des gens aidants. Et bien que ces objectifs soient ambitieux, nous sommes convaincus que le moment est venu. With today's symposium and with your participation, we hope to elevate attention to young carers a notch or few notches. At AMI-Quebec, we have already done that when 2 years ago, we engaged Oliver Fitzpatrick as our first Young Carers Coordinator, a move that demonstrates our commitment to the advancements of this dossier. You will soon hear from Oliver about the current state of affairs in that regard. Il est tout à fait clair pour nous que parler des gens aidants ne peut être efficace sans la participation active de ces dernières. Dans le symposium d'aujourd'hui, environ 20% se sont identifiés comme gens aidants actuellement ou dans le passé. Ce symposium a été conclu avec la participation active des gens aidants. Oliver lui-même, gens aidants, montra la voie. Vous reconnaîtrez les participations des gens aidants tout au long de la journée. Before I invite our special guest speaker, I would like to wish you all a stimulating and inspiring experience. Avant d'inviter notre conférencier spécial, je voudrais vous souhaiter à tous une expérience stimulante et inspirante. Our first and very special speaker is Professor Saul Becker. Professor Becker is regarded as a world leader for young carers research, policy, and practice, Having pioneered this field and worked with children and young adults with caring responsibilities for over 30 years. He has been awarded nearly 60 research awards as principal investigator from multiple sources. He has 570 publications and invited keynote conference papers, including 18 books, and advises governments, policymakers, and practitioners around the world on family carers issues, especially young carers. He was a young carer in his childhood. Saul has held professional posts at the universities of Cambridge, Sussex, Birmingham, Nottingham, and Loughborough before moving to Manchester Metropolitan University in May 2022 as Professor of Children and Families. He and his work have featured in 10 television documentaries. Saul was named by Universities UK as one of the nation's lifesavers, 100 individuals or groups based in UK universities whose work is making a life-changing difference. We're privileged to have Professor Becker sharing his experience and expertise with us. Saul, the stage is yours.
Bonjour. Forgive me that I can't do the whole presentation in French and English. I was saying on my table that as a child I learnt French at school, but I've had so little opportunity to practice it that I'm not going to subject you to my very poor French, so this will be in English. And thank you to Ella for her kind words, and also to Ella and Oliver and all the team at AMI-Quebec for organizing this symposium. So what I'd like to do for the next half an hour or so is to talk to you about what we know about young carers, what the research evidence tells us about children who have a caregiving role. And then I want to look forward. I want to focus most of the session today on what is it that we're trying to achieve and what is it that we're trying to deliver. What are the outcomes that we want to deliver for young carers? And I'm going to propose 16 points, 16 action points that will turn the dial, that will accelerate developments in Quebec for young carers based on experience from around the world and 30 years of research and advocacy. So let me start, though, at the beginning. Let me start about my own experiences, and I hope you will forgive me or indulge me for a few minutes, because I suppose I hadn't realized how important these family experiences are to me, but also to many people in this audience and many people outside around the world who champion young carers, our own experiences of caregiving. So I was 12 when I first started to care for my grandmother, and in this picture you can see my mother is the person on my screen on the left, and my grandmother is the person on the right with the white hair. And shockingly, I can see that from this picture, which was taken in 1960, when I was literally just a few months old, both my mother and grandmother seem to be wearing the same dress. And I have a feeling that in the 1960s, flowery dresses like that were all the rage. But I discovered these photos last weekend when I was preparing this speech, and it was very emotional to go through your photograph albums and discover these pictures. So that's me. I wasn't one. My grandmother was holding me in the picture on the right. And when I was 12, I started to care for my grandmother. So it was a change round. So I looked after my grandmother from the age of 12 to the age of 24. And my grandmother had Parkinson's disease. And I found that during that period, I had to do many of the things that you will hear other young carers talk about today, and that we now know from research all over the world the kinds of tasks and responsibilities which young carers have to perform. So I cared for my grandmother for that period, right through actually till when I was doing my PhD. And I remember the call, because I was lucky, I went to university. I went to university at 18, and that was lucky for a young carer to be able to leave home, because many young carers can't leave home, because who's going to look after the person in their family who needs care if there isn't another sibling? Or what will happen if you go to university and you're leaving a younger sibling to have to take over the care? And so these choices about what we call transitions to adulthood, to university, to independent life are made much more complex when you have a caring responsibility. But I was lucky to go to university, and then my grandmother passed away when I was in the middle of my PhD. And then, interestingly, I had to start caring for my mother, so the person on the left of the photograph, who also then, when I was in my 40s, she also then had Parkinson's disease. And then in the final stage of her life, she had dementia. And so my first caring experience was from 12 to young adulthood. And then my second experience was in middle adulthood into my 50s. And so that journey of two experiences of caring have been very informative. But during those periods, I have to say that none of us knew what a young carer was, because when I was 12, it was 1972. And many of you will not have been born in 1972. But you need to know that in 1972 in the United Kingdom, there was no recognition of young carers. I didn't have a label that defined myself as a young carer. There was no services. We didn't even really know what adult informal unpaid carers were. It was a period of nothingness. There was nothing for children like me and hundreds of thousands of other children, and also hundreds of thousands, if not millions, of adults who were also providing care to other family members. So that was a difficult time, because there was no support, no recognition. Young carers and adult carers had no specific legal rights or anything. So what did I learn when I was caring for my grandmother in that period of childhood? I learned the knowledge and the skills about how to help someone you love to be comfortable when they're in pain or discomfort. I learned how to feed someone who wasn't able to feed themselves, but to do it with dignity and with a sense of humor. I learned how to listen, to talk, to hear, and to be physically and emotionally present for my grandmother, who needed that kind of support. I learned how to multitask, to be able to do a whole range of caring responsibilities whilst trying to go to school. And that's the challenge. That's the set of challenges that many young carers face in terms of combining caregiving and school. And then, of course, caregiving and university. And then, of course, caregiving and independence and adult life. Because many young carers' caring roles and responsibilities don't just stop when they're 18 and they stop being children. They continue into their adulthood as well. So what have I learned since from reflections over 30 years of working with young carers? I've learned that those experiences in childhood, which I did not define as anything other than being a son, a grandson, we do not define those roles as caring. We see it as an extension, a representation of our lives, of our love, our affection, of our family duty, our bond, rather than with some label of informal or unpaid family care. But what I have recognized, and which I did not see at that time, was that how important those experiences have become or were for what I've gone on to do. So they were my past, but they were also my future. And they were my future in that those experiences define your values, your principles, what's important for you and what you hold dear and think you need to do as an adult in later life. So for me, they informed my values of what I hope are kindness, equity, fairness, public service, and the key importance of family as the glue, the moral and important glue that holds decent and good societies together. And it also taught me that it's important that we support individuals to be the best they can, to navigate the complexities of life, but it also taught me to challenge the structures and the injustices that often construct those challenges that we have to live through. So, to stand up for social justice and to try and combat the inequalities that many people live, the health inequalities and social economic inequalities, to be an advocate for individuals, but also an advocate for the cause. So in 1992, I started research on young carers. I didn't know at that time that I was going to spend the next 30 years researching and writing on young carers. In fact, the first study, and I was talking to Nick. Nick is a PhD student. Wave, Nick, and say hello. And he's on a panel later on. I was talking to Nick about my first ever study, which is called Children Who Care Inside the World of Young Carers. It's the cover that's on the left-hand side, the top left. Published in 1992 or 93. It's so long ago, I can't now remember when I published these things. But it was the first study of young carers in the UK. Children Who Care Inside the World of Young Carers. It took us a year to do that study, 9 months to find the children, 3 months to do all the research and write it up, because it was so difficult in 1992, 93 to find young carers because no one knew who they were. We had to explain to everyone, a young carer is a child, etc., etc. And even though I'd cared as a child myself, when I did this piece of research, when I started it, I hadn't connected my own childhood experiences with the fact that I was now about to do this piece of research. So even then, and I was 32 at that stage, I hadn't made the connections between my past and what would become of my future. And since then, as Ella said, there's been 60 different studies, 18 books, and lots of research that I've conducted around the world. And I've been very proud to work with people all over the world who are concerned to improve the life chances and life opportunities of young carers. So summarizing 30 years of research in one slide is always a challenge. But let me just tell you what I think we know about young carers. I think we now know who they are and what they are. We know that different methodologies produce different numbers, and I'm going to just say something about this in a little bit more detail. So that in the UK, we have a census that takes place every 10 years. And the census is completed by the head of the household, an adult who's responsible for the household. And our census, for the last 3 times, for the last 30 years, has asked a question about are the people in your family who provide unpaid family care? And if there are, it asks you to identify their age. And then it asks you to identify how many hours they're caring per week, and so on. And so the head of the household must fill this in. And basically, what the census indicates in the United Kingdom is that between 2 to 3% of all children are identified as a carer within their families by the head of the household. And the head of the household may well be the person who has the illness or the disability or the mental health problem or the addiction problem or whatever. So between 2 and 3%, a small proportion. And I always argued when those figures were published that these figures seriously would underestimate the true extent of caring amongst children, because they rely on an adult telling us whether their child is a carer. And if you think about that conceptually, there must be barriers to every adult in a household admitting that their child is a carer, telling us their age, how many hours they care per week, and then filling in an official national statistics document that basically tells people that their child is a carer. And so what I argued was we had to use a different approach to identify the true extent of caring amongst children. And that's not to ask the adult in the household, but it's to ask the children directly. And so over the last 15 years or so, I've done a number of studies, 2 with the BBC, the British Broadcasting Corporation, which basically asks children to tell us whether they are carers. And it asks them to fill in a psychometric instrument, which asks whether they do a whole range of different tasks. And if they don't do any, they're not a young carer. And if they do some, then they might be a middleweight, so to speak, young carer. And if they do a lot, then they could be what I call a heavy-end young carer. And when you do that national survey, what you find is that 1 in 5, 20%, not 2 to 3%, which we get from the census, but 20% of all children in representative samples in the UK identify that they have a caregiving role or caregiving roles, plural, within their family. And then, when you look at the amount of care that they provide, you can say that 1 in 10 of all children are providing a lot of care each week. So the key figures for you to remember are 20% of all children in the United Kingdom provide some care, and 10% of all children in the United Kingdom provide significant, heavy amounts of care. And that 10% equates to 1 million children in the United Kingdom. 10 million children, 1 million children are heavy-end young carers, and that is 3 children in every classroom, in every school, in every part of the UK. 3 children in every classroom right across the UK is the extent of caregiving amongst children. So this is an invisible and hidden population which paradoxically is not small. It's a massive, significant proportion of all children. And in a way, that sets a model for Canada, for Quebec, to identify the numbers of young carers by asking children directly. You can do surveys in schools, in classrooms, in youth centres, in social services teams, in so many different settings to find the proportion of children who will be carers. What else do we know from research? Well, we know that family members who include parents, grandparents, brothers, sisters, and so on, have a whole range of illnesses or conditions which lead to them requiring care. We know that many young carers are young, of primary school age. So our census, as identified by parents, indicates that children as young as 5 are providing care. And some of those children as young as 5 are providing full-time care, 50 hours of care or more a week, according to their parents' own admission. And we find that too when we ask children, primary school children and older children, to fill in the instruments that we use, that you find very young children who are providing large amounts of care. We know that those children are providing general nursing care, General care, nursing care, emotional care, supervision, particularly where parents have mental health problems, household management, translating where English isn't the first language. They're looking after younger brothers and sisters as well as providing care to someone who is ill or disabled. And of course, they're having to provide self-care because sometimes the capacity of their parents to provide care is diminished because of their own illness, disability, mental health problems, or increasingly in the United Kingdom, addiction problems, problems with alcohol and drug misuse, which are becoming more widespread, where children are having to take on caregiving roles for family members because of those misuses. And also we are now identifying young carers in families where there is domestic violence, where children are having to look after a parent, emotionally supporting them, or sometimes physically supporting them by getting in the way, standing in the way of a violent act to protect, in 90% of the cases, a mother from violence from another partner. And so the issue of young carers spreads much more widely than many of us recognize, and certainly much more widely than I recognized 30 years ago when I started this journey. And around 1 in 3 young carers is caring for more than one person at the same time. We also know that the outcomes of caring on children can be positive and negative at the same time. So many children talk about the positives, that they have a greater attachment for the person that they're looking after, that they feel part of the structure, the infrastructure of care and support, that they feel like they're partners in caring, maybe with health or with social services or with community organizations. But the negatives, in many cases, far outweigh the positives, because what we know from research across many countries now is that we can see clearly that for young carers, for many young carers, there are educational outcomes which include lower grades in comparison to children who don't have caring responsibilities. And lower grades means less chance to get into the best universities. And lower grades means less capacity to earn higher income in the paid labor market. And so just the simple thing about lower grades casts a shadow forward, not just in a child's childhood, but right into their adulthood and older age as well, because lower salaries is lower contributions for insurance, for pensions, and so on. And so these consequences of caring during childhood span for the whole life cycle, not just for childhood. And then there are the young carers that say they have emotional problems, anxiety, depression, loneliness, those who are physically injuring themselves by carrying parents and other family members up flights of stairs, getting them out of the bed, putting them onto the toilet, showering them, feeding them, and so on and so on. And so those negative consequences are why really we're concerned about children who are young carers. So what we also know from research is why children do become carers, and there are a range of different explanations, but they're all intersectional, they all interact. So there's not one reason. So the disability or the illness of the person who needs care, I call the trigger. It's the trigger that leads to, if you like, a cascade, like dominoes falling, of why children take on caregiving roles. And in some families, if there's no other person, it's a lone parent family with no other children, then the one child that's available will become the carer. And if there's 2 children, it might be one will become the main carer and the other one won't, and a particular child is elected into a caregiving role. You have sometimes maybe 4 or 5 children in a family and 3 or 4 of them are doing very little and one is doing most of the caring. And that's because of family structure, it's because of the ability of one particular child. That might be related to gender, or it might not. It will certainly be related to attachment and to love. It will be related to who the parent wants to provide that care, and so on. But at the end of the day, it's also related to the fact that in many families, they cannot afford another alternative. They cannot afford for someone else to come and provide that care so that the child doesn't have to do it. And that issue about how we prevent children becoming carers is one that I'll return to in a few minutes. And so one other thing that we have learned, and this is the final slide I'll say about what we know from research, is that we know that there is now a continuum of children's caregiving. And this continuum on the left-hand side has caring about. So these are the children on the left-hand side of that diagram who are really all children in our society. And these are children who are doing low levels of caregiving. It's the vast majority of our child population. They might be doing a few bits and bobs here and there, but effectively they are all children and they're doing little bits of caring about other family members who might be ill or disabled. But as you move towards the right of that continuum, you have children taking on more caregiving responsibilities. They're moving from caring about to taking care of. And as you move to the right, those responsibilities are getting more complex. They're increasing in regularity. They're increasing in time, the time it takes to do that. They're often increasing in intimacy, where we're moving from household management, budgets, translation, to giving medication, to giving injections daily, to taking people, parents, to the toilet, to changing catheters and other things, to feeding, to showering, to washing, and all of those intimate tasks of daily living. And then, when you're on the right-hand side of this diagram, you have moved from caring about to caring for. You are a young carer. You're taking on high levels of caring and responsibility. The numbers are fewer. Around about 10% of all children, as I've indicated, are taking heavy levels of caregiving. And they are providing substantial and regular aspects of caregiving and help with what we call instrumental tasks of daily life. And for many of these young carers, the evidence of negative outcomes is not just compelling, but it is globally significant in that all the countries that are working on young carers are finding these kinds of negative outcomes. A study I completed just 2 years ago was a study of young carers in 6 European countries with a sample of over 2,000 young adolescent carers, and it looked at the mental health impacts of young carers across these countries. And for the first time, not only did it show that young carers had higher levels of mental distress than non-caring children, consistent across 6 countries, but for the first time it also showed that many of those young carers were in danger of hurting themselves, deliberate self-harm is the phrase that we use, or, frighteningly, hurting someone else, including the person that they're looking after. So these findings were reported in the journals and in news items 2 years ago, because it's the first time we showed that the level of mental distress for some young carers isn't just at the level of anxiety or depression or loneliness, which they cope with, especially if they get support and recognition, but it goes to that other level of deliberate self-harm or risk of harm to other people. So the question then is, how many children are carers in different countries? That's what you want to know. But I would say to you, don't be distracted by this question, and I'll return to that in a moment. But in the UK, 2 to 3% of our children are defined as young carers by the census. 22%, 1 in 5 is defined as a young carer in terms of someone who provides some care, but 10% are the proportion of children who are providing a lot of care. Unfortunately, this slide has become slightly corrupted in the changeover. But in Canada, you have 1.25 million children aged 15 to 24. Or, from other surveys that have been done in other parts of Canada, 12% aged 12 to 17. Up to one study which showed 27%. But the difficulty we have with the Canadian data is that in these figures, you're not including children from the age of 5 or above. You're including really people aged 15 and to 24 or 12 to 17. So these surveys don't give you an accurate reflection of the extent of caring amongst children. So I can't tell you what the proportion is of all children in Canada who are young carers, because we do not know. And last night I was talking to Oliver and Ella about this and saying, why can't I have a figure that I can show you tomorrow? But I can't, because the age groups are different and the methodologies are different. So we don't know what proportion there are. But what we do know is the proportion of children who are carers in other countries, because they've used the method of asking children directly. And those proportions vary from 4% in Australia, 3% in the United States, 7% in Sweden, 8 to 10% in Switzerland, 10% in the Netherlands, and around 6% in Germany, and so on. So you can see here that there is an emerging international profile which is indicating that really the proportion of children who are carers in some of these countries that have done the work ranges between about 5 to 10%. And I would suggest that the figure, if you're like the United Kingdom, will be 10% of children in Canada who will be providing a significant amount of caring. But at the same time, I would say, don't be distracted and spend years trying to find out the true figure, because it's a waste of time. It's a waste of energy, of resources, because it doesn't matter if it's 5%, 6%, 7%, 8%, 9%, 10%. It doesn't matter if it's 750,000 of children in Canada, 1 million, 1.25 million, 1.5 million, or 1.75 million. What matters is that you have young carers in Canada who are ignored, who are invisible. No one is seeing them, and not much is happening for them, except in projects at AMI-Quebec and in Niagara and various other places across Canada. But the reality is that finding the true number of young carers is a distraction from doing something to support them. Don't fall into that trap, because that will hold you back by 5 to 10 years. So because I've been doing this for 30 years, I think my role today must be to try and accelerate what you are able to do and to help you avoid the pitfalls that will take you years to get very little. So in America, the reason why there's only one Young Carers project in America, in Boca Raton, Florida, despite the fact that they did the statistics about how many young carers are there 20 years ago when we went to launch that report, they took 2 to 3 years to do that research. And I told them over a breakfast meeting the number of children that they would have by simply working out the proportion and then looking at their population of children. And I gave them a figure, which then 3 years later, they reported the same figure. So you do not need to do this unless you really, really want to. But the trick is to move forward and do something. So in the United Kingdom, we have extensive research. We have public awareness. If you ask any taxi driver what's a young carer, they'll be able to tell you. You need to do that in Montreal. get into a taxi, the taxi driver test. And you know a taxi driver test, because this is the phrase I use, isn't the Robert De Niro taxi driver test, where they suddenly turn around and shoot you. The taxi driver test is, does your taxi driver know what a young carer is? Because if they know what a young carer is, then other parts of the population will know as well. We have widespread professional awareness, we have specific legal rights for young carers, and we have young carers strategies, and so much more. So where would Canada be in this? So I devised a scale, a classification, which shows different country reactions. And what we know is that the UK might be at the top of this because it's got legal rights, it's got policy, it's got national strategies, it's got codes of guidance for social workers, teachers, and so on. And we know what other countries look like because we've done this twice now in 2016 and 2021. But where would Canada be? Would you be at the top of this table in terms of awareness, in terms of rights, in terms of federal and local policy, in terms of awareness of social workers, teachers, healthcare workers, community organizations, lots of young carers projects supporting children? Or would you be at the lower end of this hierarchy where countries are just emerging, like Japan, which is literally just starting to develop policies and recognition for young carers? And that's an issue for you to think about. So in my last 10 minutes, let's talk about the future. Let's talk about what we're trying to do in terms of recognizing and supporting young carers. So what is the task of all of us who are concerned about young carers? The task must be to move children from a position of vulnerability, young carers, from a position of vulnerability as defined as providing inappropriate levels of care. And what is inappropriate? What is excessive care? What is inappropriate care? What should a child of 5 be allowed to do? And is that different from a child of 12, the average age of young carers in the United Kingdom, or a child of 17? And so we need to move them from providing all of that inappropriate and excessive care and the restricted childhoods and education that they have and the reduced opportunities to make friends and to participate fully, etc., as children, and the knock-on effect that has into their adulthood. We need to reduce their vulnerability to all those things, their isolation, their sense that they are alone, and the high impacts that I've discussed. We need to move them from all of that to a position of growth, to be able to learn, to be able to thrive, to be able to achieve, be protected, enjoy childhood, be supported, be identified, be assessed, and to flourish as children and to flourish as adults. So how do we do that? How do we do that in Canada? How do we do that in the UK? How do we do that in the countries that are engaging with the issue and the challenge of young carers? The first thing that we have to do is to identify them and to reach them. Children who are young carers need to have no wrong door. They should be able to go to a teacher, a person in the school who is a cleaner. They should be able to go to a GP or a friend or someone, a social worker or whoever. There should be no wrong door where they go to say to someone that I'm a child and I'm looking after my mum, my dad, they have mental health problems and disability or whatever. And they should be able to do that without fear that that will lead to another set of domino effects where their lives become out of control, where social workers look to take them into care and all the other things that might happen. And schools are a really good place to start the identification of young carers. I've learned this in the 30 years, that if you're going to start somewhere, start in your educational establishments, at school, at university as well, because many of those young carers hopefully will go to university and they will still be providing care, maybe at a distance. So identify the numbers and of students who are young carers or young adult carers and think about how we support them, just like we want to support children in classrooms across the land. Build your services and they will come. Set up initiatives and children will find a reason to be identified. Raise professional awareness and improve best practice of teachers, social workers, healthcare professionals, GPs, nurses, all of those, what we would call the children's workforce, who come into contact and who every day fail to recognize that the child in front of them is a young carer. I have spoken to thousands of professionals, psychiatrists, social workers, every professional group you could imagine, and some that I didn't even know existed. And I am still surprised when I talk to them that they say, oh yeah, I just now realize that this child that I've been working with for the last 2 years is a young carer. And then you think, well, what did you think they were if you've been working with them for 2 years? And I've had psychiatrists who told me that they've been working with children and families for over a year and have just realized that that child is a young carer. So never underestimate the possibility that a professional, despite our training, is incapable sometimes of recognizing the child is a carer within a family. We have to raise public awareness and we have to do proper assessments of need and the ability that children have to provide care. So, sorry, I realized then that I got so excited with all of that I forgot to move the slide on. Anyway, so now you have the next slide, purpose. So what is the purpose of what we do? What are we trying to do? Well, I would put it to you that there are various things that we should be trying to do. One of them is that we could consider whether we want to prevent children from becoming carers. And if we want to prevent children from becoming carers, then we need to think about how to support the ill and disabled people more, the health services, the social services, etc. Or is it that we're trying to reduce the amount of caring that a child does? That would again require us to renegotiate the caring roles and responsibilities within the family so that children or some children do less and other people do more, including outside agencies. Or is it that we're trying to intervene to get children to be better adjusted to their caring roles, to do better at school, to have better health, mental health, to get to university and do okay at university, and so on? You know, is it about enabling them to navigate through those complexities? Or is it about having a better care-life balance? And so you need to think through, what is it that you're trying to achieve by any service or intervention that you develop? And you need to devise, and we need to devise, and to deliver what we call outcomes-focused services. Services and interventions that have a specific purpose to deliver one of those things. And in a little bit, Oliver will talk about those things, because the things in brackets with the quote marks, preventative, mitigative, assistive, are phrases that Oliver uses in his presentation, and those others, prevention, reduction, intervention, etc., are phrases that we use in the UK. So what should we do that will really, really make the difference? And so now I'm on my last slide, much to the relief of the timekeepers in the session, which is 16 actions that will turn the dial. 16 things that if you think about and you try and do, you will cut out years of waste. You will be truly looking at the evidence from 20 to 30 countries who have done the work before you, and you will save years by following some of these, if you like, tips. So let me quickly go through these, because I'm sure you can't read them. But you need to focus on helping individuals, cases, and you need to be advocating for system change causes, case and cause advocacy. Your best ambassadors will be children and young adults who are carers or have been carers themselves. Their voices will be the most powerful voices to change policy, to influence the public, and to get a better deal for young carers. You need to grow your research so that you have more surveys, more studies, but don't be distracted by doing so much research that you forget to do the other 15 things on this checklist. You need to have a cross-Canadian, a pan-Canadian, rights-based covenant for young carers, saying clearly that young carers in Canada, young carers in Quebec, have the following rights, and many of them are already enshrined in the UN Convention on the Rights of the Child, which you have signed up to as a nation, and which say that children have a right to be heard, to be listened to have a voice, and so on. You need a pan-Canadian alliance, a coalition of the willing, of the organizations that support and want to support children who are carers, and including people with disabilities, mental health, and so on. You need to find your allies and work together. You need to challenge and nudge policymakers, funders, and service providers to be better. You need to use the media. The media is critical to moving this forward for public opinion. Last night in the UK, there was a documentary seen by, I think, 12 million people, 30-minute primetime documentary on young carers. And these are the things that move things forward. You need to make young carers an issue for schools, for higher education, for employment. How can we get employers to employ young adult carers who are 21, 22, if they think that person will be unreliable because they have a caregiving role at home? So we need to make sure that employers are carer-friendly as well. We need to highlight the negative outcomes, the lost opportunities, and the costs that I've described for children, but also for nation. Because this is a generation, and it's a continuous set of generations of children who are to some extent lost because of the consequences that carry forward from their childhood into their adulthood. You need to link everything I've said to the core Canadian values of fairness, of equity, of justice, and of social mobility, that we want people to have a life where they started as children doesn't mean that that will determine where they end up as adults. And for young carers, where they start as children often means that they will end up in a particular place because of everything I've said. So the cause of social mobility and social justice and fairness is inherent to what we do for young carers. We need to develop the services. Start the services and young carers will come. Because why would you come and identify yourself as a young carer if there's nothing out there for you? I wouldn't want to identify myself if I thought that there was no point. And that's the same for many young carers. They will come if there's something worth identifying themselves for. You need to have a system to assess their needs. You need to design those outcome-focused services. You need to find out what works to support young carers, why does it work? And you need to celebrate the difference that you're making for individual lives and for the cause. And if you really want, you can take those 16 items, you can put them in a self-assessment checklist, and you can ask yourself the question, for each one of those 16 items, have you started on that journey? Have you already started to move forward? Or are you just about emerging to use the media to do this, to do that? And if so, you'll put a tick in the first column. Or are you already developing those actions nicely? Is this a good work in progress? And you'll put a tick in the second column. Or are you so well established in doing that that this is now business as usual? and you'll put a tick in the third column. And you might want to do that as an exercise collectively. Where are you in Quebec on those 16 items of actions that have been shown round the world over the last 30 years to make all the difference for young carers? And if you move forward on some of those or a lot of those, you will save yourselves years. When I started researching and working on young carers, I was probably Oliver's age. And now I'm in my 60s, and it has literally taken such a long time to get things moving in the UK and in the world. So save yourself some time and enjoy learning from other countries and enjoy teaching other countries what you can achieve in Quebec to make all the difference for young carers. Thank you very much. Thank you.
Awesome. Thank you so much, Professor Becker. I wanted to make sure that we had time for question and answers because I don't know if I've reiterated for you today how excited a lot of the people in this room were that Saul is joining us here in person. I was very proud that we got to have him here. I'd love it if people here can have questions, maybe come toward Greg has a mic there that I'll come and get, and I'll bring the mic to you if you just raise your hand. And then in the chat as well, for those joining us online, if you write in the chat your questions, I'll field some of those as well. Thank you.
So there's a person over there.
Hi, thank you so much for that speech. I thought it's really important work. Is everyone hearing me? Yeah.
Yeah.
I noticed that you touched on some families not being able to afford certain types of care, and one of your graphics showed culture as well. So I was wondering if any of your research shows that maybe children that are more intersectional and part of cultures that value interdependence in the family are more at risk of being young carers. I mean, at risk or more likely to be, and whether or not they experience more negative outcomes because of the cumulative effect of their minority group.
Thank you. Thanks for that question. So the question, in case not everyone heard it, but I think you probably did, was about intersectionality and about Indigenous populations. And what we know from research in other countries, but also from policy making, is that the issue of intersectionality, which is the combination of race, of gender, of family birth order, of, well, it's a combination, really, everything, culture, socioeconomic status, and so on, is absolutely critical here, because you can't explain why a particular child in any family is the carer without thinking about all of these different intersectional issues. So that's at the core, and I know that Nick has told me that that's the area of his PhD, which I'm really looking forward to reading. We also know that in Indigenous populations, particularly in Australia and in New Zealand, the issue of young carers is really even more invisible, and it may well be the case, I suspect, here in Canada as well. So the challenges of children in Indigenous populations looking after parents who have an illness, a disability, mental health problem, or particularly in the New Zealand context of alcohol or drug misuse, are well known anecdotally, but not well researched. So there is an article that's been published recently about this from a Canadian context, which does talk about that, but there isn't terribly much research. But what we know from conversations with people in those populations and with policymakers and social workers and practitioners is that despite a lack of research, there are real issues of invisibility and the hidden nature of children caring in Indigenous populations, which we need to really think about. What are their specific needs? How does culture and all those other intersectional aspects fit together? And more importantly, what can we do to help and support them, which does not add to other stigmas that those families already experience through various other systems that don't respect them adequately?
Thank you.
Hello.
Hi.
Thank you very much. I'm a director of Montreal Caregiver Organization, and we're running since January a project for the youth caregivers in schools. And my question is really specific, but because we were really all your research and all what's happening in UK is really inspiring us over how to deal it here. And my question is how a local project or a regional project as the one we're running, how can we affect significantly the political of provincial or federal laws over the caregivers? How to have a real impact, in fact?
Thank you. That's a really good question. The first question was really good as well. So how can you have an impact on federal or local laws? So some of the 16 points that I raised were really very much trying to address that particular issue. You have to have strength and you have to have power and influence. And one of the ways to do that in terms of policy making and policy change is to have an alliance which has a loud voice. So an alliance of organizations or a coalition of organizations that come under the umbrella of one organization, but it creates this coalition with multiple members who are interested, concerned to do something about young carers, but also at the same time to respect parents who have an illness or disability. So it's not a carers lobby versus a disability lobby. It's an alliance that brings these things together, because one of the best ways to prevent children from caring is to provide better health and social services to the person who needs care. But we're never going to be able to prevent all children from taking on caregiving roles. So an alliance with a strong voice, which has authority and which cannot be ignored. You also must have the voices of young carers within that alliance, and you need to amplify the voices of young carers. So if you're going to not do years and years of research about this little minute issue or that minute issue, but trying to get young carers onto the political agenda of education, social services, health, community services, youth services, and so on, the best way, and we've learned this from across Europe and in other countries, is to give young carers the platform, enable them to be the voice. Because when they speak, particularly on television, on radio, and so on, you cannot, as a policymaker, say they're lying. You can't say, actually, I've heard that voice, but we're not going to do anything because we're not bothered or we don't care. So you have to nudge policymakers into action by showing them the voices of young carers and the testaments and narratives. So for me, how you make a political impact is do some research, but don't get bogged down in it. Give young carers a voice and make every effort to give them a platform to speak. And don't just stick them on a platform and hope it's all going to work out. Make sure that you've given them the opportunity. You've given them a bit of training. You've given them the confidence. You've shown them and spoken them, and you've rehearsed some of these things, because we would do that as professionals. So don't just dump children into that arena and hope it's all going to work out. It is very much about using those kind of models. In the UK and in the United States, there is something called community organizing. I think you have that as a thing, and so I'm a community organizer in the UK, and we're using principles of community organizing here to provoke reactions. The only way you get political change and policy change is to provoke a reaction amongst the powerful. And you provoke a reaction because they can't ignore the voices, the evidence, and the sort of power and authority of a collection of people coming together. That's how you deliver change.
Thank you.
Thank you. Well, I've never had a lineup of questions like this. It's all it's a very surreal experience.
Maybe I'll say I'll just ask that the people already at the back lined up will be the last of the questions for in-person.
I'm here all day.
Yeah. There'll be more
That
discussion.
sounds like a joke, a sort of joke line, really. I'm here all day. So I'll answer quickly. Forgive me if my answers are much shorter now.
Yeah.
Okay, please.
Hi, thank you. I would like to know if there is any study showing if there is an intergenerational transmission of being a young carer. And if yes, what will be the implication for the policies for support? Thank you.
Thank you. So I think you asked, is there an international transmission of policy and practice?
No, it's intergenerational transmission of being a young carer. That means a young carer...
Across generations? Oh, yes, okay. So thank you. Forgive me that excuse. So there is. I mean, what we know from families where there is illness and disability that's been in the family for many years is that being a carer is normalized within families. Children get socialized into these roles so that they don't see it as anything unusual particularly. And so there is an intergenerational transmission, but it's not in a negative way, because actually that transmission of a compassion and a will and desire to care for your family members and to care for strangers is something that we should all be encouraging. It's really in that continuum of children's caregiving. It's on the left-hand side. We should be encouraging all children to care about other people, strangers as well as family members. But there is an intergenerational transmission. And in some cultures, work I've done in sub-Saharan Africa is very clear that, there is an expectation that children will care for other family members when they become old, when they become frail, when they have HIV or AIDS, when they have disabilities. And those children will not just take on caregiving roles, but will also provide the main source of income. Because if the parent can't work, then children have to replace family income as well as being carers. And that intergenerational contract, as it's referred to in African culture, is really important. So there is evidence that this does get transmitted. But at one level, that's a good thing, not a negative or deficit thing. Thank you.
Thank you.
Hi.
Hi, sorry. Thank you so much for coming to speak today, first of all. It was really inspiring. And my question was that, well, I work in a nonprofit that works with people who are caregivers of someone with a mental health problem. And recently, in the past year, we've established a new program specifically for young caregivers to receive services such as counseling, for example. And in one of your points, you were saying that establish those services and they will come forward to kind of receive them, but that's not really the reality we've been having at our organization in the past year. It's mostly young adults who come forward to receive that counseling, and we've been having trouble reaching out to younger caregivers, and we start those services from the age of 12. So we've not been having as many children. And so I've been wondering if you have any advice specifically to have those younger population come forward to receive those services that we offer.
Thank you. That's a really good question as well. So look, it's really difficult for a child of 12 to identify in their life experience the value of counseling, because even the phrase counseling isn't a child-friendly phrase. It's a professional phrase. It's like the word assessment. We talk about you must assess young carers. Well, children think assessment is an exam. They think it's something that takes place at school with coursework. So the language that we use is part of the problem for some children. And so the reality is that, I can see that there would be an issue that children might not recognize what counseling is. They might certainly not think that it's got any advantages for them. They might feel that identifying themselves and receiving counselling could be quite stigmatizing. Their parents may certainly not want them to receive counselling because it labels the family in a particular way, that the child needs counselling because the parents maybe are not as good parents as... So you have a whole range of challenges. I would suggest that one of the best ways of dealing with that challenge at a system level is to have an awareness-raising campaign in Quebec. And I would suggest that you do that, and I suggested this last night. You start to publicize what young carers are across a range of different places, on bus stops, in doctors' surgeries, in hospitals, and so on, saying, you know, with a picture of a child, different children, different ethnic backgrounds, etc., simply saying very simple things like, my name is whatever, I care for my mother with a mental health problem, my name is another one, my brother has a disability and my mum uses a wheelchair, etc., etc. Very simple images. Images are more important sometimes than words which confuse children. They will identify with an image even if they don't know what counselling is, and literally have a campaign across the city which shows all of this, and then with a place where young carers can contact, not multiple different agencies, but either an advice line, a helpline, or a project in which they can go and see what happens. And if you want to discuss it further, and I can give you more ideas, just email me. And
Thank you so much.
It's a pleasure. Hi.
I'm one of those words that confuse children. I'm a counselor, and I work for an agency that supports, I guess, young carers that are impacted by addiction or substance use. And one of the things that I found were a lot of young people come with substance. They got in trouble because they were caught with drugs or they were using drugs, and we started adding this question because of the first symposium, where we ask everybody, do you spend a lot of time taking care of someone that you love? And generally the response is pretty cautious, pretty, yeah, it's cautious. And I think, you know, when we talk a lot more, something I've discovered is there's an incredible amount of stigma around being a young carer, especially around child protection. Cool. And when I heard you talking about those surveys that you were doing, I was wondering, you know, what question did you ask young people? And do you have advice around our questioning? We put that question every intake we do with young people, but I'm wondering if that's an appropriate question, if we could use different wording or procedure or something like that.
Thank you. So this is a real challenge because identifying children who are looking after parents with substance misuse, because of the stigma and sometimes the illegality. So, you know, in the UK, the kinds of, let's say, substances or drugs that parents might take, some of them might be legal here, but many of them are not. And so to identify yourself as a child looking after a parent who's misusing an illegal drug is incredibly difficult. And in a way, why would they want to be identified? Because they don't know whether your intervention will be benign and helpful or whether it could then involve child protection agencies or even the police. So there is that stigma and there is a real fear of what might happen. So in a way, it's quite difficult to be so specific about, do you care for someone who misuses substances? In a way, it's probably more helpful to go the generic route, which is, do you look after someone who has a need, rather than do you look after someone who misuses substances? And from that, you might then discover the children who are looking specifically after substance misusing parents or other family members. I mean, the boundary with child protection is really complex. I had cases where some kids were used to score for parents. So some young carers were sent out to get the drugs by parents. And of course, that becomes a child protection issue. But what I would say is the generic route. We do have an instrument which is translated into French as well as English, which is used in 20 countries, called the MACA. It stands for the Multidimensional Assessment of Caring Activities. And it's an 18-item self-report instrument, which I'm sure you can get from Oliver and Ella, or just email me directly.
Could you say that one more time?
It's the MACA, the Multidimensional Assessment of Caring Activities.
Okay,
it's a psychometric instrument used in schools, in hospitals, in community organizations. It takes 2 minutes for a child to fill in. It can be used to assess a young carer's caring roles, what they do, and also the amount of caring that they do. And it can be used as a screening device in schools or other settings to identify young carers, because if they answer, yes, I do a lot of these, then you know that they're a young carer. Right. You could use the MACA to help you navigate through that particular issue. And then there's the PANOC, another self-assessment, which is the Positive and Negative Outcomes of Caring questionnaire, the Positive and Negative Outcomes of Caring questionnaire, which is a 20-item scale, which shows the positive adaptation to caring of children and the negative adaptation. And in that questionnaire, there are a couple of questions which are very much clinical questions, which are about the future safety of the child. So there are at least 2 instruments specially designed for assessing and for identifying the strengths and difficulties of young carers, which in clinical practice would be really excellent. And they're also in French.
Oh, awesome. Thank you.
Thank you.
Hi.
Hello.
I work as a student advocate within a university, and one of the main things we do is help students and advocate for them and getting them various accommodations based on their different needs and situations. So my question is, what types of accommodations are recommended for university students who are carers?
Okay, thank you. So the issue for many young carers in the United Kingdom, particularly at my university, Manchester Metropolitan, because we're 42,000 students, we take most of our students from low-income families. It's not an elite university like Cambridge, where I used to work. It's very much about first-generation students, lots of students from minority communities, and a significant proportion of those students actually don't live at university. They chose Manchester Met because it's close to home, and they go home at night to care. And at the weekends, you know, they're there. But for those students that come to university who are living away from home, some of them will choose to go as far away from home as possible to try to break some of that link, because in some cases, this can be very problematic, and it's an escape, okay? But in other cases, young carers will live as close to their home lives as they can. And so having a hall of residence or accommodation, particularly where they might get to know other young carers, would be really good, because what they don't want is to have to start to narrate their lives to people who have no understanding. So the great benefit of Young Carers projects is that you don't have to start from scratch, because everyone in that room, when you're doing a group session, is a young carer. They know what's going on. And that mutual peer support is so critical. So it's not necessarily about where they live at university. It's about who they meet and what support you provide at university. So make sure that you have a support system for young adult carers. Make sure that they can meet and know that they're not alone. Make sure that they recognize that other students are going home to care at the weekends, which is what I did, and all holidays to give my mum a break. Make sure that your systems are sensitive and flexible, so that if a young carer is falling asleep in class or can't get to classes sometimes, or is not able to hand in their assessment, their coursework, that sometimes there's flexibility. have contextual admissions processes. So rather than just doing it on grades, the UK system has moved to contextual admissions, which is that people write a narrative about who they are, and we can look at their backgrounds, whether they are care experienced, they've been in local authority care, whether they're estranged from their family, whether their parents, whether they've been fostered or adopted, whether they're young carers, because that gives us a sense of who they are, but also what they bring to the university and the opportunities. But again, there's a massive amount of research and publications and guidance on how universities should better support students. And if you want me to give you access to any of that, simply email me and I'll give you the sources.
Thank you so much.
Pleasure.
Hello, hello. Can you hear me okay?
I can. Thank you.
Hi, my name is Hyun Gu. I work for what's called the University Institute Sherpa here in Montreal. And we're currently working on a provincial project, research project with migrant populations and English-speaking communities in Quebec. And in the research, we're finding out already that there's, we talk about intersectionality, that, we're seeing people be invisibilized based on status. And so my question to you is, do you have any information on young carers who are perhaps taking care of their family members or someone in their network who have precarious status in this country? We have 500,000 people in this country that are undocumented from different parts of the world. And so I'm just curious about any research information on young carers in these particular contexts of migrant populations.
Thank you. So there is research published on this, and if you go into Google Scholar and put in some keywords, you will find some of those articles. What we know, again, is that if young carers are invisible, young carers in migrant or asylum-seeking families or undocumented are even more invisible for so many reasons of, illegal status, et cetera, stigma, blah, blah, blah. They are really difficult to identify for very good reasons. And most of them probably don't want to be identified because they have no idea what will happen if you know about them. And so, we can understand what's going on there. But all I would say, just as a sort of aside to that, is that from evidence of talking to practitioners and to families, children in migrant families and asylum-seeking families, we do know that this is increasing, particularly as Ella started her presentation and acknowledged the state of the world at the moment. So children living in families where there is armed conflict, children who are living in families who are trying to escape from one country across the channel, say, to the UK, and you will have seen, no doubt, the news reports of thousands of people drowning in the Mediterranean and other places. And those that do get to land, whether it's in Italy, in Lampedusa, or in the UK and the Kent coast, or in France, in Calais, or wherever it might be, those children are providing significant care whilst traumatized themselves to families and parents and brothers and sisters who are themselves profoundly traumatized, many of whom will be injured from conflicts, et cetera. So for me, this is a really important issue because it's an issue that is a barometer to some extent of our common humanity and decency. And it needs far more research, but it's an incidence that I think is going to get worse and worse. So you don't even have to have kids and families coming across water. You just have to look in war-torn areas, where children will be carrying the load of caring, emotional support, physical support, medical support, and we know so little about this. So any projects that are specifically dedicated to that are absolutely honourable and important, but you are treading in an area which is so difficult to actually do anything in terms of identification. So again, build a service, ensure it's advertised in the most non-stigmatizing, non-judgmental, neutral, compassionate, humanistic, social justice way, and one will hope that some of those children will be willing to be identified.
Thank you.
Thank you. I'm afraid that's it. I thank you. I thank you for the extra time that you've given me today. So it's been a real pleasure. I am here all day, so if anyone wants to speak to me later on, please just come up and grab me. Thank you very much.